Hey guys, today we're going to talk a little bit about scars, surgical scars specifically. So when you think about scars, there's 4 different things to consider. Number 1, most of scarring is determined by your own skin biology, that is your genes. Some people are going to be prone to scar worse than others. Number 2, the anatomic location. So depending on where the scar is, some places scars heal very well and are less noticeable. Other places the scars can be widened or what we call hypertrophic or even keloided. Third is the tension on the surgery itself. So classic example is where you have a lot of tension, let's say in a tummy tuck, the scar tends to be a little wider because that tension helps to pull that wound a little bit apart, and that chronic tension ends up with a wider scar. Finally, there's surgical technique and aftercare. And of those 4 things, I think the first 2 are very important, the genetics and the location. And then the tension is probably the next most important. And lastly, it's the technique. So what can you as the patient do to help attenuate or decrease some of the scarring? So number 1, you want to think about tension, and you want to avoid tension in the perioperative period. So if it's a scar, let's say on your arm from a brachioplasty, you want to avoid doing a lot of swinging motions with your arm. So just basically use common sense so that you don't do too much in terms of activity around the scar line. Number 2, around 3 to 4 weeks, you want to start applying some of the anti-scar techniques, and most of them, there are different types, brands, most of them revolve around the idea of compression with silicone. So a silicone-based tape is helpful, paper tape itself is helpful, but something that's going to help the skin edges adhere and apply some compression, I think, can help. The only caveat with this, however, is that sometimes the tape or the silicone itself can induce inflammation. So your body basically gets irritated by it, and that irritation or excess inflammation can make your scar worse. So with that in mind, go ahead, use the silicone-based tape or other kind of compression mechanism, but keep in mind and be aware of what the impact of that is, and if it starts to irritate your incision, take it off, let it dry naturally. Thank you, and we'll see you again soon.